Okay, good evening, everyone in radio, YouTube, and TV land. Welcome back to another episode of HealthWise. I am your host, Dr. Monique Lescott, in collaboration with the St. Kitts Nevis Medical and Dental Association and ZIZ. Welcome, welcome, welcome. So this evening is going to be a very special edition. It's going to be our focus tonight is not going to be a particular topic. We are basically, this is our season finale. Until the middle of October, we'll be back. We're going to take a short break for a few weeks. So tonight's format of the show is not going to be like your regular format. It's not going to be a topic of discussion. We're basically going to go through and highlight all of the past shows from before and basically just give thanks and go over all of the previous topics that we did before. That's basically what it is. So we're going to recap the highlights, and instead of our regular scheduled programming, let us start off by our first item. Basically, I need to give a public service announcement concerning the layout of the emergency room department at JNF at the moment. We made a few changes in terms of the protocol of persons when you come to be seen. We're asking the general public to be mindful of the triage process, and we introduce a few protocols in the emergency room department as you enter, just for everybody's safety and for speedy, how should I say, to basically enhance the service of the doctors behind. We've been getting a few complaints. Sometimes persons feel as though it's a first come, first serve situation, and it really isn't. So I'm going to ask my technician to please go to our quick PSA firstly on this slide. I think it's slide number 10. Slide number 10. Yeah, so quickly, our quick PSA about the emergency room. Videos and audio recording is no longer allowed in the emergency room. That's basically for your protection and confidentiality. I know sometimes persons, it's not that we have anything to hide, but we have to be mindful of the privacy of other persons that are being seen in the emergency room that may not necessarily want to be on anyone's footage, because sometimes when you're ill, you're not feeling well, you're not in the best of moods, it's very a bit annoying and rude to have a total stranger video recording and you don't know if you're going to end up in the footage. We've had complaints about that. And as a result, cell phone use will be limited once you step behind closed doors or once you step into the waiting area of the emergency room. So after triaging, you will receive a color band indicating whether you are considered the international code of 1, 2, 3, 4, or 5 based on the severity of symptoms, vital sign derangements, or presented history, meaning your status to be seen will be determined by your vitals. We will determine how soon or how not soon a doctor would be able to come and see you, because we're basically trying to prioritize the most emergency case, obviously because it's an emergency room. So the blue will be seen first. That is the highest priority. Blue will be seen first, then red as soon as possible. Once all blue bands have had a start of treatment, then the yellow. Only after red have been seen, then green after yellows have been seen. So it's color coordinated based on priority of emergency symptoms or situations. So blue is the first priority, then you have red, then there's yellow, and green is the least emergent. Blue is the most emergent. The white bands are not truly hospital cases and are more so for health center or doctor office cases, but will be seen after greens are recommended to another site if between the hours of Monday to Friday 8 a.m. So if the emergency room at JNF is full with the blue, red, and yellow coded patients, green or white coded patients may kindly be asked to instead please try a service elsewhere, maybe at Poxon, Mary Charles, depending. Maybe we might refer you to a health center, a nearby health center, if it's within health center hours, somewhere close to your home. So we are asking for the general public to please have some patience with us. It's not that we're trying to, how should I say, not be attentive to everyone's need. We're not trying to discriminate. We're not trying to be partial. But for the efficiency and organization of the doctors working behind and for the safety and care of everyone, JNF has decided to include this protocol. If my technician can allow you to see these changes, we have a few signs in the emergency room where we will have our security. For right now, we have stipulated that the security will know you're going to be subject to searches because there's no firearm, knives, drugs, or alcohol allowed on your person once you come to be seen by the doctor. Also, we are having a zero tolerance for verbal and physical abuse. So any belligerent language, aggressive behavior, the police can, in some cases, be notified, or our private security that's on staff would be asked to step in to diffuse any tense situations, because it does happen from time to time. And for the safety of everyone involved, we are strongly advising persons when you come to the hospital that you dress properly, meaning you don't dress with your arms out, shorts, belly out, or breasts out. We are asking that you please don't bring any firearms, and no weapons, no knives, no drugs or alcohol. And please refrain from abusive language or aggressive behavior towards the staff. So that is our quick PSA for this evening. So thank you very much for listening. So for our quick recap this evening, we are going to go through for all of the shows that we had for the past, I would say, 6 months. We had the suicide awareness, we had a World Tuberculosis Day, we had International Nurses Day, we had sickle cell anemia, we had quality and compliance healthcare, and we had the antenatal care along with the hepatitis. All those were past topics of our show. And I did receive very, very encouraging feedback from you members of the general public. I really appreciate your encouragement. The show tonight was supposed to be formatted with me and the other co-host, Dr. Davis, and Dr. Serene was supposed to be here, but they couldn't make it this evening. So I'm the one that's going to basically close the season for all of us. We were going to stay and we were going to come together and discuss all of the past topics, but that wasn't able to happen. So I'm going to be the one to do it myself. When we discussed the tuberculosis topics, for one thing, a lot of persons apparently, they did not know that we at JNF, we have specialized care and isolation unit for persons who is suffering from tuberculosis. So although it's one of those complicated conditions, it's not that rare, and it is very much possible to be treated at JNF in a timely manner that we see results. There's also, sorry, just a minute. Yes, so there are specialized medications that we distribute at JNF. Anyone that is suffering from tuberculosis, there's an isolation unit on the ward, so there is no problem with transmission of any of the symptoms or any issues with the tuberculosis disease, because it's highly contagious. We also went through topics like sickle cell anemia. A lot of persons did not seem to understand that sickle cell is not contagious. Some persons were of the impression that it's contagious, that if you share utensils or if you share a small space with someone with sickle cell, some persons expressed to me that they always thought that it was something contagious when it actually really isn't. And I was happy to be the one to shine a light on most of these topics along with my co-hosts. We were very, very happy to shine a light on most of these topics as educational opportunities for the public. It was my pleasure to teach, in a way, I guess. I learned as well, and I was happy to have members of the general public learn along with me. So we also identified suicide awareness and suicide risk in the Federation. We raised awareness about that. We had a whole suicide and mental health awareness drive early in the year. Persons benefited from timely intervention. We were able to screen persons for early signs of mental health issues, and I'm hoping that in the not too distant future that we are able to do more of a rollout and basically to reach more persons in the community, because mental health illnesses have become more mainstream, and so we definitely need to reach out to persons who might not have resources or might not know who to turn to in times of mental health crisis. I think it's time for a short break. When we come back, we are going to elaborate on more of the highlights topics. Thank you very much.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
For those of you who are just joining us, welcome, and those of you who have been with us from the beginning, welcome back. I'm your host, Dr. Lescott. As I explained to you guys before, this will be a very special edition of HealthWise. It's not going to have a particular topic. This is our finale. We are basically taking a break from now until middle of October. So instead of having a regular scheduled program where we discuss and elaborate on a particular topic, we basically just going to have a rundown of our past shows and the past topics that we had for the first half of the year, the first 6 months of the year. And then we're going to break until October. So I'm not sure if ZIZ will be playing any of the reruns from earlier in the year, but we won't have any fresh material until October. So we're going to continue our show, our discussion. I would like to go straight into our personality spotlight. Her name is, just a minute. Sorry, her name is Dr. Bernicia Nisbet.
Our medical personality is Dr. Bernicia Nisbet. Dr. Bernicia Nisbet is a general practitioner living in Lavington on the outskirts of Sadler's Village. After earning her medical degree at the Celia Sanchez Mandalay Medical Science Faculty, she started her career as a medical officer at the Accident and Emergency Department before rotating through several disciplines of medicine, then transitioning to the role of a district medical officer, which she has held for the past 7 years. In her current capacity, Dr. Nisbet has worked in several community health clinics and is responsible for a wide range of primary healthcare services. As a district medical officer, she collaborates with the police and works closely with the social welfare service to ensure integrated patient care. Outside her demanding professional responsibilities, Dr. Nisbet finds fulfillment in helping people, regardless of their age, gender, or background. Dr. Nisbet is guided by the quote, "Good, better, best. Never let it rest till your good is better and your better is best." Our medical personality is Dr. Bernicia Nisbet.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live better.
And welcome back again, everyone. My name is Dr. Monique Lescott. I am your host tonight for this evening's HealthWise. Our area of discussion this evening won't be of any particular topic. We're basically just highlighting all of the shows that we did already for the year, for the first half of the year. And so I was just basically going through all of the topics that we have already covered. So we also took time to recognize International Nurses Day. That was commemorated with, I think, a month of activities. I had a lovely guest with me. Her name was Nurse Jamisha. I work alongside her. She's a pleasure to work with. I was very grateful to have her alongside with me for the promotion of the Nurses Week that they were having at the time. I was not able to source any of the nurses to come on the show this evening to help me to collaborate and to elaborate on what was the outcome of their week of activities, but I was told it was a huge success. They had a dinner, and the turnout was quite nice. Everyone was looking nice, and I was really happy to have Nurse Jamisha on the platform here to highlight and let the public know what the nurses were up to. I thank you, Nurse Jamisha. I hope that you're able to come and be a guest on our show again. We also had Dr. Davis. She was the one who covered the topic of hepatitis. I wish she was also here to help me elaborate on hepatitis. That was her area. She elaborated on it very well. She shined a lot of light on that area. I don't think many persons were aware of the different types of hepatitis that is actually in existence, but they affect us all, and they're very much, it's a public health issue that can easily be sometimes solved by simply washing your hands after using the bathroom and what's not. Hepatitis is not always, in all cases, a sexually transmitted disease. Sometimes it can be passed along in the environment. So hygiene and proper washing of hands is actually very important in latrines and bathroom areas. The hepatitis virus, especially hepatitis A, it's rampant in public bathroom areas, you know. So that was a very timely piece that Dr. Davis was able to bring to you guys. We also had Dr. Davis discuss the antenatal care. She was very, how should I say? She shined a light on many of the instances of antenatal care that I think a lot of us may have overlooked, particularly at the health, our local health, on the local health level. Dr. Davis was instrumental in bringing many of the antenatal issues to light. So again, I wish she was here to elaborate on that topic, but she wasn't able to make it this evening. Just a minute, please. Okay, so I forgot to mention that we also had a topic referring to obesity and health. That was a very big topic. Nutrition is a very big topic for us at the Ministry of Health. I was able to have one of our nutritionists come on the show and highlight for us what we can do to, how should I say, utilize food and nutrition to sustain immunity and to maintain good health throughout. Sorry. So right now we're going to go straight into our bulletin with Dr. Morton. He's going to inform us of the new happenings at JNF and the new happenings in the Ministry of Health in general. So please stand by for Dr. Jensen Morton.
And I'm here with Pastor Donna Palano, and she's our new chaplain at the JNF Hospital. Greetings. How are you doing?
I am very well, thank you.
Could you give us a little bit of a feedback on what you do?
Okay, so I am here at the hospital every day, offering spiritual support to the patients, you know, in their time, in their most vulnerable time, and just to encourage them, just to lift them up. You know, sometimes I would just sit with them, listen to them, you know, etc.
So you're here full time and you're here every day?
Yes.
Wonderful. Have you seen a difference in not just patients, but say the staff? How has the staff received your presence? Do they also seek spiritual upliftment at times?
I would say yes, they do. Actually, the staff has really embraced you know, my place here, and they're always so pleasant, always so accommodating, and I think that they are glad for the help, the assistance as well, you know, in dealing with the patients, and I think that they see the importance of it, you know, because like I have said, you know, the nurses, the doctors, they are doing their thing, they are in and out, but I get the opportunity to just linger a while, linger with them, hear what's on their heart, talk with them, calm their fears, you know, help to, you know, calm their worries and, you know, the stresses that they may feel, and just bring that sense of peace, just bring that sense of peace, you know, whenever you are dealing with God and spiritual things. You know, God is able to bring that level of comfort.
That's true.
Yes.
And statistics show that when persons receive spiritual upliftment, we have better patient outcome all the time.
Yes.
So we really appreciate you. We welcome you. When we put out that we have a new chaplain, it was well received by the public as well. Persons were excited, and we're looking forward to even, you know, better results, better patient outcomes, and just having you be, as you said, an upliftment to both staff and patients.
Yes.
Anything you want to say to the listening audience before we wrap up?
Well, I just like to say how thankful I am for this opportunity to be able to help people. You know, my mantra has always been love God, love people. And so this is like putting on my own shoe, where it's my comfort zone, you know, just being able to be a source of help, a source of strength. So I count it a joy, I count it a privilege.
Lovely. Thank you.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
And welcome back, everyone, for those of you who were with us from before, and welcome for those of you who are joining us for the first time. My name is Dr. Monique Lescott, your host. Like I mentioned before, this week's HealthWise is not the typical schedule HealthWise, as we won't be discussing any particular topic. We basically just went through the rundown of the highlights or the past shows that we did for the first half of the year. Which we did quite a few topics. And to just let you, the public, know that we are going to be taking a short break from now until the middle of October. So this is basically like a season finale where we take the opportunity to just thank you guys for tuning in, for your support, for your encouragement, for your helpful suggestions, and for basically being such a huge support to the initiative and for what we are trying to do. I'm really thankful. I've been humbled many times by members of the public. You guys have approached me and expressed how grateful you are for the show, for the information. It's my pleasure to do the research, to do the work, and to bring all of the knowledge and information that I've learned to your homes, to your screen. And so I would like to take this opportunity right now to thank some persons who were very instrumental in allowing me this opportunity to express myself and to do what I love. One big thank you would go to Miss Dr. Joylette Woodley. Without her, I don't think I would have had the courage or even the thought to come and be here and to be a part of such a great initiative. Thank you, Dr. Woodley. I really appreciate you. You're appreciated. Dr. Morton, he is very instrumental as well, sometimes on short notice. I'm always able to call on Dr. Morton to give the bulletin, to give us, and my apologies about earlier, it wasn't Dr. Morton who did that last bulletin, but I'm sure he was the one that coordinated it. He usually does it, and I would really like to thank Dr. Morton for always being flexible, for always being available, and for always lending a helping hand wherever he can. He's very encouraging, and I'd like to thank him. I would like to thank my two co-hosts who were not able to make it tonight. They were also very instrumental in bringing a fresh new perspective to the show and for bringing fresh topics that they also brought themselves and researched and collaborated with to bring to you guys. I would really like to thank the staff and team of ZIZ. They're very accommodating. They go all out. They basically try to give us what we need to make the show a quality success that it is. I would also like to thank Ms. Lindsay Maynard of JNF. Ms. Maynard has allowed our team at ZIZ to film different aspects and area of the hospital, which sometimes isn't an easy thing to do because it's a hospital, it's busy, and we strive for excellence and professionalism. We don't want to have any breach of any confidentiality. And so Ms. Maynard was very instrumental with allowing the ZIZ camera crew to come to to come to JNF and to film certain things in certain areas in a safe way that is not intrusive to any of the staff or the patients. Thank you very much, Ms. Maynard. All of the personality spotlights, I cannot name you guys all, but I know it was an apprehension for some of you. You guys were shy, but in order to help, assist, and support Dr. Lescott, you guys overcame your shyness and came through and supported HealthWise. And I would really, really, really like to thank you guys who pushed through your shyness and supported HealthWise and was part of the personality spotlight I thank you very much. And I would also like to thank you, the general public. Like I said, you guys have been a huge source of motivation and inspiration. I've gotten so much feedback, positive feedback. I don't think I've ever had a negative feedback from anybody in the general public. You guys have given me the motivation to keep pressing on. Sometimes it's not easy to do an entire show for a whole hour by myself, but you guys have given me the motivation to do it, and I really, really, really appreciate you. And I would really like to thank everyone from the bottom of my heart for your support, for tuning in every Sunday, and for making HealthWise a part of your evening routine. So this is where this season of HealthWise will come to a close. I will be sure to come with fresh new topics in October for the rest of the year so that we can have insightful and timely discussions. So again, I am your host, Dr. Monique Lescott. I really thank you guys, and welcome. Sorry, this is the end of the show, and I will welcome you to the next season of HealthWise in October. Thank you.